Assalamu alaikum wa rahmatullahi wa barakatuh. Yet again, we're back with Health Check, a program where we bring you medical advice from medical experts. Today, we're discussing once again eye problems or eye ailments, and I have an eye expert by the names of Dr. Herbert. You're most welcome.
Thank you so much for having me.
You're most welcome once again.
Thanks
for
much.
Always honoring our invitations. And today's topic of discussion is AMD.
Yes.
Is AMD.
Yes,
and what are the AMDs? These are the aged, you can help me.
Age-related macular degeneration.
Age-related
macular degeneration.
Macular degeneration.
Yes, sir.
I didn't know that from the very beginning. And you have to explain a little bit more for I and our viewer outside there to understand.
Yes, sir.
Please go ahead.
Yes, today our topic of discussion is age-related macular degeneration. And the eye has a part inside there at the retina called the macula. And this part is responsible for giving us clarity of vision, the clearness of vision, for you to be able to contrast and differentiate between colors, numbers, shapes, sizes. That is the part that is responsible for that. It's called the macula. Now we are discussing a disease called age-related macular degeneration. And it's an eye problem or an eye disease that affects older people, 50 years and above.
So should I assume I'm safe?
You are safe for now.
Okay.
Yes. So it is a disease that affects elderly people 50 years and above, and it affects the part of the eye called the macula. Yeah, so what happens is that the person has a shadow at the center of his vision. Because this part is the one that is responsible for giving us sharpness of vision, central vision. Yeah, now if this person is seeing, literally, has a shadow in front of their eyes because of the damage of the
center,
macula.
there is a shadow. But the other two sides, it's very clear.
It is clear, but the center has a shadow. So that is age-related macular degeneration, an eye problem that causes impairment of central vision. Impairment of central vision.
Do we have types under the AMD?
Yes, we have types of AMD or age-related macular degeneration. And we have a type called dry macular degeneration.
Dry macular
And then you also have wet macular degeneration. You might find in other places it will be called exudative macular degeneration, which is called wet macular degeneration, or non-exudative macular degeneration, which we call dry macular degeneration.
Let's start with the wet one.
We start with the wet one. Thank you very much. Now, the difference between the wet macular degeneration and the dry macular degeneration is that at the macula, there is bleeding. There is formation of new blood vessels, and then bleeding starts happening at that part that I've talked about called the macula, that is responsible for giving us clearness or clarity of central vision. Yes. So now, in wet macular degeneration, this person will have bleeding in that place at the macula. We'll have new blood vessels being formed, and these new blood vessels will start bleeding at the macula. Yeah. So for dry macular degeneration, on the other hand, is that the person will have exudates seeping through the retina at that part of the macula. So you'll see some damages on the macula, but there'll be no bleeding yet. There'll be no bleeding, in other words. So for wet macular degeneration, you'll see new blood vessels being formed and also bleeding at the macula. So that's the difference. In other words, the other one is wet because there is blood, and the other is dry because there is no blood.
Thank you so much, Doctor. From what you have explained, how does one realize that now I might be at risk of having an AMD? Or when does one know? What are the symptoms?
What are the symptoms? Thank you very much. Very important to know. Yeah, so the symptoms, one, a person will see a dark shade in front of them. And sometimes others may not realize where exactly it is. They think maybe something that's over the eyes. They try to take it out or clean the eyes, but there's a shade that is constantly there. You see someone, but there's a shade at the center. So one of the symptoms that you'll see a shade in your vision, a dark shade in your vision. Number two you'll not be able to recognize faces. Because central vision, at where the face is supposed to be clear, there is a dark shadow.
You know that this is a human being, but you can't identify who exactly
you can't recognize the face. Is that him? Is he the one? So you can't recognize faces clearly. Number two, if you have been using spectacles, you'll find yourself changing spectacles all the time. Say, I think this pair is not working. 1 month, 2 months, you're changing into another spectacle. Then you should think or suspect that you could be having a macular degeneration.
Okay.
Changing spectacles frequently. The other thing is that this person will have a glare, something we call glare. When light is flashed in them, it is kind of scattered in the eyes and they can't see clearly under bright light. Yes.
And what could be the risk factors of AMD?
Yes. What could be the risk factors of AMD? One, and most important, age. As you grow older,
you're at a higher risk.
Yeah, you're at a higher risk of getting macular degeneration.
Okay.
Number two, smoking. People who smoke, they're at a higher risk of getting macular degeneration.
Okay.
Yes. People with other systemic diseases like hypertension and diabetes, they're at a higher risk of getting macular degeneration.
Okay.
Yes. Even alcoholic people who abuse alcohol are also at a higher risk of getting macular degeneration.
Okay.
Yes.
And what could be the causes?
What could be the causes? Now, the causes, not well explained or not well known, but we have these risk factors that are leading us to this condition. And one of those is age. As you age, certain changes are happening in your body. And also these changes are also happening inside the eyes as you age. So the degeneration is also happening due to the advancement in your age. Yeah, so that is one of the highest risk factors and the highest causes of this macular degeneration.
Okay.
Yes.
Thank you, Dr. Herbert. Our viewer, I hope you're following and you're getting entertained as you're getting the advice and taught or teaching from today's medical expert or eye specialist. Doctor, there is a misconception that we seek clarity.
Yes.
Are the AMDs curable?
Yes.
Or not?
Yeah, so AMD is
many people say they are not curable, yet others say it is curable. Which is which?
And also maybe to explain more, the dry ARMD, the dry macular degeneration, is actually the commonest one, causing about 90% of the cases of macular degeneration. That is dry. Then the 10% for the wet macular degeneration. So this disease is treatable, and there are different kinds of treatment plans that we can have to treat this person. Yeah, there's no definite treatment that we can take away because we have learned that's a degenerative thing that is happening due to advancement in age. But there are treatments that we can give that can stop advancement, that can reduce the advancement, or can reduce the complications due to the disease.
Okay.
Yes.
Okay.
Yeah. So it is indeed treatable. It's indeed treatable, and once on treatment, we have seen many people recover.
Okay.
They become better, on treatment.
Thank you so much, Doctor. Yes, much as it is treatable.
Yes.
But we have a saying, one of my friends, a doctor also, Dr. Beka Katurinda, he has been visiting us here several times. He has a saying that prevention is cheap, and cure is expensive.
Very right.
And we all know that prevention is better than cure. So you better prevent yourself from acquiring any disease than treating such a disease, because there are chances it might be not treatable.
Yes.
What could be the preventive measures one should take to prevent themselves from the two types of AMDs?
Yes. Now, it is important for someone to know that they have to maintain a good diet. A diet that is rich in vitamins, vitamin E, vitamin D, vitamin K, vitamin A. Those maintain the functioning of the body, and not just the body, but the eyes as well.
Okay.
Yeah, so you have to eat things that are rich in vegetables and fruits that are rich in vitamins. This can help you in the long run. Yeah. So also exercising and maintaining a good weight is also important.
Okay.
Maintaining a good weight and exercising is very, very important. Yeah, because obesity is one of those things that can cause complications after complications, even to the eyes.
Okay.
Yes. So maintaining a healthy weight is important.
Okay.
Number 3, avoid or quit smoking. Okay. Smoking, alcoholism. We see very many cases of macular degeneration among smokers, among alcoholics. So quit such habits and get new habits like physical exercise, hydrating, and doing other activities rather than smoking and drinking.
Okay.
Yeah. So in that way, you'll prevent yourself from many complications, even for the eyes, as macular degeneration. Yeah.
Thank you so much, Doctor. Doctor, before we close, I would like you to give us some advice to these two people,
Yes.
the one that has acquired the dry AMD and the other that has the wet AMD. What advice do you have for the two of those ones?
Yes, thank you very much. Now, routine visits to the hospital are very important.
Okay.
Yeah. When a person has such conditions, they need to have many follow-ups with an eye doctor to continue treating them, because this disease can advance to different stages, and different treatments can work for different stages. Okay.
Okay.
Yeah. So for people with dry ARMD, normally we advise them on the diet, and also we give some supplements, tablets as supplements, antioxidants, to try to improve the health of the retina. And then those with wet ARMD, those ones are even at a higher risk of even turning blind because of the bleeding that is happening behind there. So some of those, they keep coming to the hospital for many visits, put them on treatment. Others go ahead even to introduce some medicine into the eye to stop.
Actually, there I have a question.
Yes.
What treatments can you prescribe, or
Yes.
what kinds of treatments do you give to people with such types of AMDs, the dry and the wet one?
Yes. So now for the dry, as I was saying, we give antioxidants, tablets, supplements, and also advise them about the diet and the general health of their bodies, and give antioxidants. These try to improve the health of the retina and the macula.
Okay.
Yes. And then for those with wet age-related macular degeneration, where there is active bleeding at the macula, we introduce treatments like anti-vascular endothelial growth factors that stop growth of new blood vessels around that area that are bleeding. So once there are no blood vessels, new blood vessels that are growing, and bleeding is stopped, even their vision improves actually. Yeah, so normally they get injections depending on the stage. Can get 1 or 2, 3 times of injections of this drug, depending on the stage of the disease.
Okay.
And of course, routine follow-ups, routine eye checkups to monitor how this person is doing. Others go for surgery, others go for laser photocoagulation. We destroy the blood vessels that are bleeding with laser and clean up the retina that is bleeding, such that the person can recover sight. Yeah, so some of those are the different treatment ranges. So as you can see clearly that there are different ways we can treat this person. Okay. So there should be no one to say that there's no treatment for my condition or what. Everyone should come to the hospital, and at which stage that they'll find you, at least they'll treat you. They'll give you treatment. Okay. Yes.
Thank you so much, Doctor. Our viewer, unfortunately, this is the time we have to call off. In case you miss this program, or you come in the evening of this program, we have a YouTube channel where you can go, MTA for Africa. You can check in the playlist. You will see the health check programs. Many of them are there, so it is there for you on YouTube. And in case you're wondering where to watch us next time, you might be in the at the neighbor's place. You might have visited someone at the office. You can watch MTA online on your phone, on your laptops, on your smart TVs. Just download the MTA International application. Specifically for this program, there are several channels on MTA. Then you can search for or look for MTA for Africa. There you'll find this channel. Just tune in same time and watch MTA. For now, Doctor, do you have any concluding remarks before we sign out?
Yes, concluding remarks. Thank you very much, our viewers, for listening. Important to take home is that a routine eye check is important in discovering some of these conditions.
Okay.
Yeah, so you shouldn't go 3 years, 4 years, 5 years without having an eye checkup, especially if you are even older in age, 50 years and going up. You should have at least an eye check every 2 times at least in a year, even when you don't have any complaints.
Okay.
Yeah, so because when we discover some of these things early, we can treat them better.
Okay.
When it is late, it will be also, the treatment becomes a bit harder.
Okay.
Yes.
Thank you so much. That is Dr. Herbert there for you. Till we meet next time, I remain your host, Nambali Bashir. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you.